Hi, this is Dr. Pan from Taiwan. Thanks for having me in this great event. Today, I would like to give you an overview on injectable scaffolds, which are very possible a hot topic in our future pain practice. I have nothing to disclose. This is the outline of my talk. First, why injectable scaffolds? We are regenerative pain practitioners. We treat pain via tissue repair and regeneration. And our mindset shows there's a trinity of tissue engineering, including cells, scaffolds, and signals. And we are very familiar with the signals, which includes dextrose, PRP, exosomes, and cytokines. We are also very familiar with cells, which may include MSCs, autologous tenocytes, and iPSC. But what about scaffolds? Most of us are not really familiar with that. But we know that cells can't survive just by themselves. They need extracellular matrix. And these matrix offer the cells not only with physical environment, which can give them support, adhesion, or migration. They also have biological effect, which they can attract native cells. They can attract native cells by various ways. One is for stiffness. There will be a gradient to attract certain type of cells. Or they can attract, the scaffold can attract cells via electrical fields. They also provide cells with immunological environments. And in turn, if we use the scaffold, injectable scaffold properly, we can upgrade our treatment for pain patients from cell therapy to tissue engineering on the needle tip. So there's a regeneration synergy combining these three trinity. And finally, with injectable scaffolds with signals and cells, we can provide our damaged tissue, painful damaged tissue, a favorable microenvironment, mimicking the extracellular matrix, and thus achieving the goal of sutureless repair. And that's why. So there are three types of injectable scaffolds, namely the natural ones, synthetic scaffolds, and decellularized scaffolds. The most common natural type of injectable scaffolds are polyurethane fibrin. And as you can see on the right bottom of the slide, there are 3D structures showing their porous structures supporting the microenvironment. Not only the quality of the natural PRF scaffold provides a good environment for the cells, but we have to consider when we're doing injectable scaffold, the dose-dependent effect of that PRF medium. The second most common used natural type of injectable scaffold are the HA scaffolds. Most of them are made from natural ones, which are chicken crowns. And we can also make them into different forms of HA scaffolds, which are gel type or the solid types. We can even use plants for natural scaffolds use. The second type of the injectable scaffolds are synthetic scaffolds. And most common ones are injectable hydrogels, as shown here. So they are polymer type, and various special ones can be made for special purposes. We can include the magnetic hydrogels, photoresponsive hydrogels, thermoresponsive hydrogels, and conductive hydrogels. And most of the synthetic hydrogels are made from natural material. And what we are going to achieve is to mimic a natural structure of the extracellular matrix, and in this case, a collagen mimetic organic and inorganic hydrogel for cartilage engineering. And we are trying our best to mimic the 3D or triple helix formation like a collagen fiber for synthetic hydrogels. But when we synthesize these synthetic hydrogels or scaffold, there's a very important topic. We have to consider the porosity of the hydrogels or the scaffold, because we have to let the cell to migrate inside and forming new vessels, which are called angiogenesis. And the different forms are needed for different purposes of tissue regeneration. And in this study, it shows that a nerve conduit-like scaffold with synthetic material with porous structures are very suitable for nerve regeneration purposes. And during the process of making these scaffold, we can use electrospawn technique to make a specialized fibers. The last type of injectable scaffolds are decellularized scaffolds, which means that for a tissue, the cells inside are removed and the residual materials are processed to be an injectable form. So this is an example showing that in the pig meniscus, they can be processed by first moving the cells, and then there are different processing methods to make it an injectable hydrogels for future 3D printing. And this is very interesting because different tissue-made decellularized scaffold would potentially provide different potentials for tissue differentiation. And in this study shows that in the intervertebral disc, an MP-like decellularized scaffold may make the implanted cells to differentiate into MP-like cells. And that happens as well in the annulus fibrosis decellularized scaffold. So after the 3 types of injectable scaffolds, I would like to share with you the combination of these Trinity components. So to make it very clear, I will show on the left column of the slide which components are used, namely the cells for C, biosignals for N, and scaffold for F. We also add the extracellular matrix for E because some of the so-called scaffold are just made from homogeneous extracellular matrix, not independent scaffolds by definition here. So this is one of the examples showing that from nose to spine, the spheroids generated by human nasal chondrocytes for scaffold-free NP augmentation. So in this case, the scaffold or the extracellular matrix are together made with the cells. So that's not by definition the scaffold, but the homogeneous extracellular matrix. And another example is very common used currently, that is SVF, stromal vascular fraction. And in this study, it shows that the SVF provides bioactive scaffold, but again, by definition, this will not be called an independent injectable scaffold, but a combined mixture of cells and its own homologous extracellular matrix. And this is the real one, combining cells, homogeneous extracellular matrix with an independent synthetic scaffold. So it's from a combination of stromal vascular fraction with HA-based scaffold to treat osteochondral defects. And this is another example showing that a gelatin hydrogel can be combined with cell spheroid to facilitate wound repair. And this is another example showing that there's no extracellular matrix added on the cells, but the cells are laden inside the scaffold in this sheep model of intravertebral disc injection for regeneration. The cells are loaded inside the collagen hydrogels for regenerative purposes. And this is another example showing that a cell-laden scaffold in a different form to treat nerve regeneration in vivo. Another combination type is adding biosignals into the scaffold. And in this case, there is an extracellular vesicle from adipose tissue that will add into a decellularized adipose tissue scaffold to treat for tissue engineered purposes. And this is another example showing the self-healing anti-inflammatory hydrogels together with ultralong extracellular vesicles, and combining, they provide synergistically enhances motor function recovery of spinal cord injury. And for stroke, this is a very good study showing that hydrogel delivered extracellular vesicles, which combines both scaffold and biosignals in the recovery of motor function stroke. So after the combination of the scaffold, we will talk about something about the injection processes, especially for our interventional pain physicians. Most of us will think that, oh, just combine them together and mix them, inject on the target tissue. Well, that's normal. But there are some details which may be different from each other. First, the mixture of that combo can be made prior to injection, or they can be done during the injection, which means we have to mix them together during the injection. We can even use the most new technique, which is 3D bioprinting for scaffold injection. And the 3D bioprinted scaffolds will have not only biomimetic microstructure, but also providing the tissue with very good microenvironment for, in this case, meniscus regeneration. And the most key technology for 3D bioprinted injectable scaffolds is that they can provide you a custom-made tendon bone interface technology, which is called spatially gradient technology. So in this slide, it shows that in different area of these scaffolds, the combination of the gradient is different. So from the tendon side, it has more tendon part, and from the osseous side, it has more bony part. So make it a gradient spatially different patch. And in this study shows that we can use the 3D printed gradient patch to enhance the regeneration of torn rotator cuff. So as a regenerative pain practitioners, we inject things, but how can we do the 3D printing with our already known techniques? Well, there are three types of bioprinting currently, namely the inject bioprinting, laser-assisted bioprinting, and extruding bioprinting. And these two are mostly made from surgery, so that's not our topic. But how about this laser-assisted bioprinting? And in this case, it shows that the material for scaffold formation can be injected first into the live body, and then they can be photosensitized by laser outside the body. And then when the material, the raw material, receive the energy of the laser, it will form into our targeted structure of the scaffold. So we call it intravital 3D bioprinting. So as a regenerative pain practitioner, we can use these concepts to apply our already known technique by using ultrasound to do the injection of the raw material, use the laser to guide our targeting scaffold formation, and even we can use ultrasound-guided percutaneous needle laser 3D bioprinting in the near future. And there is also another way to enhance our way to do injectable scaffold formation. It's called a post-injection designs. Let me share with you some examples. They can be made after the injection with in situ crosslink. So it will not crosslink before the injection, but after injection. They can heal, even you break that hydrogel, they can heal by themselves. And they can even degrade into the size that can allow a new cells, new tissue to infiltrate into the injectable scaffold. So that's no problem, as you can see here. So after you inject, the scaffold will form whatever we want them to form. And this is even great because we call it injectable cryogel, because before injection is a 3D structure before, and during the injection, they will be compact and into the needle. And after injection, they will restore to original shape after injection. We call it injectable cryogels. And this is a clinical example for these cells. We call it shape memory cryogel for cartilage defect repair. So after all these introductions, are we ready for scaffold injecting pain interventions? We have various techniques which are very useful in the future injection of these scaffolds. But for grafting, we may not be allowed to do this. But we have image technique, we have image modalities which can evaluate non-invasively for these scaffolds. We can use even the future high resolution ultrasound to differentiate how the scaffold function or not. And as a pain interventionist in the process of nerve regeneration, we know that in the first step is surgery, right? But what about after that? We can do it in the fibrin bridge formation stage. We have role in the strong cell migration stage. We can have role even in axonal regeneration stage. So although we are not surgeon, we still have role in the nerve regeneration processes, especially when we have the concept of injectable scaffold. And another example is meniscus regeneration. We can do injection, image-guided injection, even in every single stage of meniscus regeneration. We also know, as a pain physician, the niche of intervertebral disc regeneration. So we know how to localize them and deliver them, not only cells, but also injectable scaffolds. So in conclusion, we cannot make these chemicals. We don't have the ability. We can't make these 3D bioprinted scaffold. But as a pain physician, we have to know what are we really injecting into our patients. And we have definitely roles in the process of tissue engineering or tissue regeneration, even now and in the future. So the cells need extracellular matrix. They provide not only the physical environment, biological and immunological environment. There's still a long way to go for injectable scaffold, and thanks for your listening.